In the bustling world of medical care, certain health tests often fall to the wayside, yet they wield immense power in safeguarding lives. As individuals, it's paramount to embrace the knowledge surrounding vital health screenings that can significantly impact our well-being. First on the list are blood pressure tests, a simple yet life-saving measure that can detect hypertension, a silent killer that poses risks of heart disease and stroke. Regular checks can prevent these life-threatening conditions from spiraling out of control. Next, we delve into cholesterol screenings. High cholesterol levels can lead to perilous cardiovascular complications. A simple blood test can offer insights into your cholesterol levels, enabling proactive measures to improve heart health before it's too late. Furthermore, a diabetes screening is crucial. As the prevalence of diabetes continues to rise, early detection through routine tests can promote lifestyle changes and treatments that thwart the trajectory towards serious complications, such as kidney failure or vision loss. Equally significant is the colonoscopy, a procedure that aids in the early detection of colorectal cancer, the third leading cause of cancer-related deaths. Many shy away from this test due to embarrassment, but it can be pivotal in identifying polyps before they develop into cancer. Then we must address the importance of mammograms for breast cancer screening. Women should undergo mammograms regularly after the age of 40. This proactive step can catch irregularities early, enhancing treatment success rates. Another critical test involves prostate-specific antigen, PSA, screenings for men, which can detect prostate cancer early on. Given the often silent nature of this disease, men should engage in conversations with their healthcare providers about when to commence testing based on risk factors. Additionally, vitamin D deficiency screenings can be a game changer for numerous individuals, particularly those with limited sun exposure. Adequate vitamin D levels are essential for bone health and immune function, making this test a surprisingly vital one. Finally, we must not overlook the importance of mental health screenings. Conditions such as depression and anxiety can be masked by physical health, yet they directly affect our overall health. Proactively addressing mental well-being can lead to better management of physical conditions and improve quality of life. In summary, these 7 health tests are not merely suggestions. They are essential lifelines that every individual must advocate for in collaboration with their healthcare providers. Ignoring them could lead to devastating outcomes, whereas embracing them means prioritizing your health. In the ever-evolving landscape of medicine, the mantra, "Prevention is better than cure," rings louder than ever. For doctors, being cognizant of vital health tests is crucial. Unfortunately, there are critical health tests often overlooked that could mean the difference between life and death. This warning calls for immediate introspection and action within the medical community and beyond. First on the list are cholesterol screenings. High levels of LDL cholesterol can silently pave the way for heart disease, a leading cause of death worldwide. Regular screening can provide early warnings, prompting lifestyle changes or interventions that can effectively lower risks. Unfortunately, many patients leave their annual checkups without this essential test, leaving their cardiovascular health unchecked and vulnerable. Next, a comprehensive metabolic panel plays a crucial role. This panel checks for kidney function, blood sugar levels, and electrolyte balance, among other things. Neglecting this test can result in the late discovery of diabetes or kidney disorders, which can progress silently. Early detection through this test empowers individuals with the ability to manage their health effectively, leading to better outcomes. Moreover, colonoscopies should not be treated casually. For adults over 45, this test can catch colorectal cancer at its infancy. Ignoring the importance of regular screenings is tantamount to ignoring the chances of survival. The subtle symptoms can often be overlooked, making the colonoscopy an indispensable tool in proactive healthcare. Pap smears and HPV tests for women are equally crucial. These tests can identify precancerous changes in the cervix, allowing for early interventions. The reluctance to recommend these tests can lead to rising incidences of cervical cancer, which echoes the urgent need for medical practitioners to prioritize these screenings in women's health discussions. Additionally, bone density tests are frequently dismissed, but they hold immense significance, especially for postmenopausal women. Osteoporosis can progress without visible symptoms until a fracture occurs. Regular bone density screenings can unveil underlying issues, allowing individuals to take preventive measures to guard their skeletal health. Lastly, mental health screenings must not be relegated to the sidelines. The stigma surrounding mental health can deter patients from seeking help. By prioritizing mental health assessments, doctors can open the door to necessary conversations, reducing the occurrence of untreated mental health disorders, which can be life-threatening. As we journey through life, our health often takes a back seat to the hustle and bustle of daily routines. However, some essential health tests can act as life-saving measures, and it is crucial for doctors to emphasize their importance to patients. Ignoring these tests can lead to preventable health issues or even life-threatening conditions. The first test that deserves attention is the cholesterol screening. Elevated cholesterol levels can quietly build up in the arteries, increasing the risk of heart disease or stroke. A simple blood test can provide insight into one's cholesterol levels, allowing for early intervention through diet and lifestyle changes. Another significant test is the blood pressure screening. High blood pressure, often labeled the silent killer, can cause severe damage to the heart, kidneys, and other organs over time without noticeable symptoms. Regular monitoring of blood pressure is essential in detecting this condition early, enabling timely management and reducing the risk of complications. Diabetes screening is another critical health test that must not be ignored. With diabetes on the rise globally, testing fasting blood sugar or hemoglobin A1C levels can provide valuable information about one's risk for developing diabetes or managing an existing condition. Early detection allows individuals to make necessary lifestyle adjustments, potentially reversing the disease's progression. Additionally, screenings for colorectal cancer are vital for individuals over a certain age. This test can identify precancerous polyps or early-stage cancers, allowing for prompt treatment before it becomes more serious. It is essential for healthcare providers to encourage patients to undergo this life-saving screening, as it can significantly reduce mortality rates. Likewise, cervical cancer screenings are fundamental in women's health. A pap smear can detect abnormal cells in the cervix early on when treatment is most effective. Educating women about the importance of regular screenings empowers them to take charge of their health. Lastly, a comprehensive metabolic panel can uncover underlying health problems, including kidney and liver function, electrolyte balance, and blood sugar levels. By monitoring these factors, physicians can provide personalized care and preventive measures, keeping patients healthier over the long run. In the whirlwind of medical consultations, vital health tests often fall through the cracks. Doctors, amidst busy schedules and numerous patients, sometimes overlook important screenings that could mean the difference between life and death. Today, let's shine a spotlight on 7 crucial health tests that deserve immediate attention to safeguard not just the lives of patients, but their overall well-being. These are not mere suggestions. They are essential tools in preventive care that can lead to early detection and treatment of serious conditions. First on the list is the cholesterol test. High cholesterol levels build plaque in arteries, leading to heart disease or strokes. Regular monitoring allows individuals to manage their cholesterol through lifestyle changes or medication, significantly reducing their risk. Next, the blood pressure check is essential. The silent killer often manifests without symptoms, yet it can lead to heart failure or kidney disease. Knowing one's numbers empowers patients to take action before significant damage occurs. The third test to prioritize is diabetes screening. With diabetes rising at alarming rates globally, early detection is key to managing this chronic illness. A simple blood test can reveal prediabetes or diabetes, allowing for life-changing interventions. Following closely is the colon cancer screening for those over 45. This test saves lives by detecting polyps before they turn cancerous. The thought of a colonoscopy may be daunting, but the reward is incomparable. Peace of mind and protection against one of the deadliest cancers. Women should never skip the mammogram, as it is crucial in the fight against breast cancer. Early diagnosis increases survival rates drastically. Similarly, men should regularly check their prostate-specific antigen, PSA levels, to catch any abnormalities early on. Finally, the hepatitis C screening shouldn't be ignored, especially among baby boomers and those at risk. This silent virus can lead to severe liver damage without causing noticeable symptoms for years. In conclusion, the health tests mentioned are not just numbers on a page, they are lifelines. Doctors must take these screenings seriously and advocate for them during consultations. Patients, too, should be proactive in requesting these tests. Ignoring these health screenings is a risk no one should take. Take control of your health, insist on these life-saving tests, and together, let's foster a culture that prioritizes preventative care. In the realm of healthcare, certain tests act as silent sentries guarding against unforeseeable health threats. Yet many patients and even some doctors overlook these crucial health assessments. As a patient, it's essential to advocate for yourself and understand the importance of these 7 tests that can potentially save your life. Imagine walking through life with a silent enemy lurking in your body, one that could be revealed with a simple blood test. The lipid panel, for instance, measures cholesterol levels, a key indicator of heart health. High cholesterol is a significant risk factor for heart disease, which remains a leading cause of death. Regular monitoring can enable proactive measures, turning a potential health crisis into a manageable condition, bringing peace of mind and longevity. Next, don't underestimate the power of the fasting glucose test. This simple blood analysis checks for diabetes, a chronic condition that affects millions worldwide. Undiagnosed diabetes can lead to severe complications, including heart disease, nerve damage, and kidney issues. By catching it early through this test, you empower yourself to make lifestyle changes that can markedly improve your health trajectory, shifting from a reactive to a proactive approach. Meanwhile, the importance of colon cancer screening cannot be overstated. The colonoscopy remains the gold standard, allowing for early detection of potential cancer before it even starts. Consider the idea of soft whispers of warnings from your body. A colonoscopy can reveal early signs, enabling interventions that could save your life. Moreover, mammograms are vital for breast health, especially for women over the age of 40. Regular screenings help in detecting breast cancer at its most treatable stages, turning fears of the unknown into informed action. Imagine knowing that you are doing everything in your power to catch something early before it escalates into a more serious concern. Furthermore, don't forget the power of a simple thyroid hormone test. Thyroid conditions can lead to weight gain, fatigue, and other debilitating symptoms. Detecting an imbalance early means you can adjust your lifestyle or treatment to restore balance and vitality, leaving no room for the exhaustion that often accompanies ignorance. Finally, consider discussing the benefits of prostate-specific antigen, PSA testing with a healthcare provider. For men over a certain age, monitoring PSA levels can be pivotal in detecting prostate cancer early. Awareness is a powerful tool. Use it to safeguard your future. By embracing these tests, you transform your health narrative from one of neglect to proactive assurance. Let your voice echo in the halls of healthcare, demanding attention to that which truly matters, your health.